card that we all get from the federal government. So I won't say anything more about that. Can you all hear me with my mask on? And maybe I'll just stay standing. It'll help a little better. So my name is Cathy Bern-Smith. I am the manager of the Schenectady County Department of Senior and Long-Term Care Services. We are located at 107 Knott Terrace on the 3rd floor. It's the Schaefer apartment building, Schaefer Senior Apartment Buildings, that pink sandstone building on Knott Terrace. I'm sure you're all familiar with it. That's where we're located, and I've passed out some placemats for you. We have some additional masks that we're going to provide for you, and up here I have some information that you can take, when I'm done, about the programs and services we provide. I was here probably a year or so ago with some folks from Eddie Pace and the Alzheimer's Association, and we did a presentation based on the Jeopardy game. Some of you may have been here for that, and we asked all different kinds of questions in the Jeopardy format. We provided the answer. You folks gave us the question on all different kinds of services in Schenectady County. So I have been here before. Thank you for the invitation to invite me back. I really appreciate it. As you can imagine, during this period of COVID, these types of presentations have been somewhat limited, primarily because places have been closed, right? It's only fairly recently that senior centers, other meal sites throughout the county have been able to reopen. So what I'd like to do is just briefly describe some of what we do. If you have any questions, I'm happy to answer them. So the Department of Senior and Long-Term Care Services is a merged unit of the Department of Social Services Long-Term Care Unit and traditional Office for the Aging Services. So on the DSS Long-Term Care side, that program is for folks who are eligible for and receiving community-based Medicaid. There's a difference between institutional Medicaid and community-based Medicaid. The institutional Medicaid is when folks need to go into a nursing home. But there is a program for folks who are eligible for Medicaid that provides for aid service, Personal Care 1 or Personal Care 2, to help them stay in their homes as well. And it's based on Medicaid rules and regulations. We have a DSS long-term care nurse, and we have a DSS long-term care caseworker who go out to do in-home assessments to see if someone is actually eligible programmatically for that program. Just because someone has community-based Medicaid to pay for that service doesn't necessarily mean that their current medical condition would allow them to participate in that program, because maybe their medical needs are higher or greater than what that program can safely provide for them. In that instance, if someone is not medically eligible as determined by the nursing assessment, we would work with that client to give them information on the next level of care, the next higher level of care that they could potentially be eligible for. We don't just leave people hanging. So that's one part of the services that we provide. The other part of the services that we provide are for Office for the Aging clients, folks who are 60 years of age and older who still live in the community, so they haven't been transitioned to a higher level of care. And those programs include congregate meal program, the program here in Niskayuna that we run with the assistance of Catholic Charities, who's our subcontractor for congregate meals, is at the JCC. So some of you are probably aware of that meal program at JCC on Balltown Road. That meal program is run through our office with funding from the New York State Office for the Aging, and we subcontract with Catholic Charities to run that program. We also have a meal program at the Glenville Senior Center, again, funding through the State Office for the Aging with Catholic Charities. We have a meal program at Our Lady of Fatima in Delancey, again through Catholic Charities, and at the Tenite apartment buildings in downtown Schenectady. At this particular moment, the two programs that are open are at the Glenville Senior Center and at Our Lady of Fatima in Delancey. We anticipate the program at JCC opening sometime next month. The 1st of October, the 10th of October, stay tuned. Right now, the program at the Tenite apartment building is not open. I think to building management's credit, they are very, very concerned about letting people from the outside into that environment, and I think you can all understand why. The folks who were traditionally participating in that meal program have actually been added to our home delivered meal list, home delivered meal routes. We partner with Catholic Charities. The funding is through the New York State Office for the Aging. We have a subcontract with Catholic Charities to run our home delivered meal program too. So those folks are being taken care of just in a little bit of a different way. The programs that we run directly in our office, we have a caregiver support program that is run by a licensed social worker. Her name is Wendy Petrosi. We provide caregiver support groups. Again, we had to sort of readjust everything that we do once everything really shut down in March. We started to provide all our services over the phone. We do assessments and reassessments over the phone, caregiver support groups that used to meet in person, face-to-face, over the phone through freeconferencecall.com. We have a legal services program where if someone is in need of an attorney and you currently don't have your own attorney, we can provide legal services. The lawyer used to come to our office once a week. Everything has been done over the phone since the middle of March. And for those services that require face-to-face, we are still providing mostly by phone. Every once in a while, if a case manager needs to go drop off an application or assist someone completing an application, we will make that home visit. The attorney is still doing all his quote-unquote visits, services, but by phone. And we think that'll probably continue for the foreseeable future. Let me say a little bit about our legal services. So if currently you don't have access to your own attorney, you can call our office if you need the services, if you think you need the services for an attorney. We will have our intake worker ask you a few questions about what type of legal assistance you need, and she will schedule you for an appointment. Our attorney's name is Richard Wickerham. There are no fees for this service, although for all our programs, we do encourage folks to donate whatever they feel they can donate. Some folks do provide us with donations. Some folks are unable to. No one is denied a service in our program for their inability to donate, give a donation. As you can imagine, for this particular service, he provides initially 1/2 hour of free legal service. He's a pretty popular person in Schenectady County, right? You can imagine. So, and as a result, his schedule tends to get filled up pretty quickly. So if you call our office, and for the most part, he's still providing his services on Wednesday. If you need legal assistance, please feel free to call our office. If he happens to be busy, say next Wednesday, we'll try to get you on the schedule for the following Wednesday. Please understand that a 1/2 hour of free legal service is a pretty important commodity for folks like yourselves, and so we just ask that you be a little understanding and patient if we can't get you on the schedule right away. The other program that we provide is something called the Expanded In-Home Services for the Elderly program, ISEP for short. We never speak in full words, it would just take up too much time. So ISEP is the acronym for that program. And that program too is a home care program. We subcontract with pretty much all the aid agencies in Schenectady County. And that program is for people who are above the income eligibility guidelines for Medicaid. And basically the way that program works, there is a fee for that program. It's based on a sliding fee scale. So generally, the more income you have, the higher your resources, the more you will pay towards that service. The lower your income and the lower your resources, the less you will pay for your aid service. How much will you pay for your aid service? It depends on how many hours you receive, and it depends if it's personal care 1, which is housekeeping, laundry, meal prep, grocery shopping, or personal care 2, which is hands-on service. Help getting dressed, help bathing, help getting in and out of a chair. Anytime personal care 2 services are offered, you can think about those services where somebody actually needs to touch you to help you do what you need to do to get done. Personal care 2 services are a bit more expensive than personal care 1, but on this ISEP program, we have people who pay 100% of their services, and we have people at the other end who don't pay anything. We refer to it as cost share. And it really depends on someone's individual situation. I wouldn't be able to give you an exact amount because everybody's situation is different. But we've had people on this program really for many, many, many years. And sometimes if someone's medical situation changes and we feel that we can't continue to serve them safely, we will work with them to transition them to a higher level of care. So the way this program works is that someone will call our office, an intake will be done, It will be referred to the supervisor of that unit, who will assign the case to an ISEP case manager. The ISEP case manager will call you or call the person who's made the referral. Sometimes adult children prefer us to call them first before they go see mom and dad. And then an appointment is made for a case manager to come out and do an in-home visit, an in-home assessment to collect income information, to collect medical information, to develop a care plan, to see what it is you might need assistance with. And then what we do is we work with the aid agencies in Schenectady County that we have subcontracts with to see if they have staff available to provide the service that you need. That's how that program works. And it differs from the DSS long-term care program in that DSS long-term care requires doctor's orders before we go out to make an assessment. ISEP program does not require doctor's orders. DSS requires a nursing assessment. ISEP does not require a nursing assessment. So the program has rules and regulations. They are not nearly as strict as what we have from the Department of Health and in terms of DSS long-term care. We have a Tai Chi for arthritis program, again, that we've run for probably a couple of years now. Everything shut down, lock, stock, and barrel. What was it? March 13th, March 18th, no in-program, in-person services were being held. That program is set to start again on Friday, October 2nd at the Annie Schaefer apartment building, Schaefer Heights apartment building. The building management has provided us with space. All social distancing protocols will be required. Folks will be wearing masks. It is, Tai Chi for Arthritis is basically a share-based program that we run, and people have been asking for this program for really months and months and months now. So if you are interested in this program, I've got some brochures and some phone numbers for you that you can call, and we have a program coordinator for that. Wendy Petrosi is her name. Her information is on some of this documentation here. Please feel free to call us and ask us about that program. When we first ran that program, it's a couple of years now, folks would come using walkers, using canes, using other assisted devices. By the time the program ended, nobody was using any of that. So it really does work. It is an evidence-based program. Again, if anybody is interested, costs you nothing to make a phone call and see if you might be interested in that. And Wendy can help you with all the specifics and all the particulars. I'm trying to think if I have forgotten anything. Do you have any questions? I've been talking now for 20 minutes. That's a long time to talk. I don't want to bore you. Yes, sir.
I just like to make a comment that I availed myself of your services, and Wendy Petrosi is wonderful. She's been a very great help.
Thank you so much. I appreciate that. Wendy is will be with us 2 years, I believe, in November, and we're really thrilled with what she has done and how she has expanded the caregiver program. But it's always nice to hear from the community how folks find the interaction with our staff. It's very important. so.
Are you involved at all with the Meals on Wheels program?
Yes, so sometimes there are two names for a program that delivers food to people. One is Meals on Wheels, right? Everybody is pretty much familiar with that, but Meals on Wheels, thank you so much for the water, I appreciate that. Meals on Wheels is actually its own corporation and entity. It's its own organization. The program that we run through Catholic Charities, we refer to as home delivered meals, just not to confuse the two. But yes, the program that we run through Catholic Charities sometimes is also referred to as Meals on Wheels. The names can be interchangeable.
Are there qualifications, like you have to be low income and?
There are qualifications
Yeah.
for that program. Income is not, the Meals on Wheels and the programs that I described at JCC and the Glenville Senior Center, et cetera, are not income based. For Meals on Wheels home delivered meals, we do an intake and we ask about your ability to shop, your ability to prepare meals for yourself, your ability to prepare meals at home. Do you have a refrigerator? Do you have a stove? Sometimes we find folks only have microwaves or only feel safe using microwaves. So there are other programmatic questions we ask to see if folks are eligible. Right now, we are trying to serve as many people as possible because, say before COVID hit, right? Maybe you were able to go out grocery shopping. Well, maybe we don't want so many people out grocery shopping now, right? I mean, you're all wearing masks, but let me tell you, I go out and I see people not wearing masks. It's pretty scary. So the situations have changed slightly in that we are in the middle of a major disaster declaration, both primarily on the state level. And as a result of that major disaster declaration, county offices for the aging have been given a little leeway in terms of doing all those assessments and reassessments. For home delivered meals, there is a process of doing an initial assessment through something called Compass, which is a statewide program that we are required to use when we assess someone for home delivered meals. Right now, we don't really need to go through, and it's a fairly lengthy and involved assessment. We don't have to use that right now, but we will ask some basic questions about your ability to cook, even your ability to get out and shop. Do you have someone who can shop for you? Do you have the ability to call Hannaford and Price Chopper and have them put your grocery package together and deliver to you? So we're asking questions that way because obviously our caseload has increased due to COVID. But neither program, congregate meals or home delivered Meals on Wheels, is income based. I'm going to take a sip here.
Thank you.
You're welcome. Yes, ma'am.
If you have a home caregiver come on your level 2, you said where they help you physically, where they have to touch you. If you have diabetes, are they allowed to give you your insulin shot?
No.
Okay. What about cutting your fingernails or toenails?
No.
No.
Those are considered, medical.
Who would do that then? Who would you get? to
Well,
do
if you could not, do your own insulin shot, we would
Right.
work with you to see if we could find someone
that? Okay.
to help you. Same thing with clipping nails and clipping toenails. Clipping toenails, we try to get you hooked up with a podiatrist,
Okay.
okay?
Would you have to get a nurse to do the insulin shots?
The nurse, may be able to do that if it's DSS long-term care. If it is, ISEP program, we would need to follow up and, see if we could get someone from visiting nurses, to do that for you, or to teach you how to do that yourself.
Well, I meant if you cannot do it yourself, can you, so you either get the nurse, or could you get a family member to do it? That's allowed? I mean, I don't
Excuse me.
understand why a family member can do it, not a caregiver, that's what I don't understand.
A caregiver, a personal 1 aide, or a personal 2-level aide is licensed to provide certain services under that title.
Okay.
And the agency has to be very, very careful. Let me share with you a personal story. My father-in-law, towards the end of his life, was diagnosed with diabetes. He was diagnosed with diabetes in October, and he died in January. And he was in the hospital. His glucose level was so high, it didn't even register on the glucose meter that the first responders used.
Wow.
Okay, he got into the hospital, his glucose level was 999. That's pretty high.
Oh.
999.
So he lived to tell the story. Fast forward, he was discharged to home. He had follow-up appointments with nurse practitioner. They recommended insulin for him. And I asked why. I mean, he was 90 or whatever. Can't this just be controlled on oral medication? And she said, not really. He will just feel better. The insulin will help him feel better. Okay. So, ordered the insulin. My husband was able to give him the insulin. He was 90 or 91. There's no way he was going to be able to give himself those shots. My husband was able to do that, and that was allowed because my husband had power of attorney, next of kin. I tried to do it. I don't know if you've ever seen an insulin needle. It's a very small, thin needle. I could not give him a shot without it hurting. So some people are able to do that. Other people are just not. I just don't have that skill, and I tell people the world is a safer place because I'm not a nurse. So I have a lot of respect for nurses who walk around in this, I'm dying in this now, who have to wear these masks all day long, right? So again, the aid agencies have a license. And what I had wanted to say in terms of my father-in-law, there were times when we used the Day Haven program located at Schaefer Heights for him. The person at the time who ran that program was a registered nurse. And I said, you're a nurse, why can't you give him his insulin? Because the requirements of the Day Haven program prohibited her to do that even though she was a nurse. So.
I have a question.
Yes, ma'am.
I tried the Meals on Wheels, and some of them are okay, but I'm really not crazy about them. And you probably can't answer this, but is there a difference in the Catholic Charities meals than there is in the Meals on Wheels?
I don't I don't know that, so if you went through some other program that could deliver you meals, I don't know. What I do know about Catholic Charities programs, and this is both for the congregate program, JCC, Glenville Senior Center, and Meals on Wheels, those meals have to meet essentially 1/3 RDA requirements as set by the New York State Office for the Aging. Because we get federal money, state money to run those programs. Those menus are developed by a registered dietitian who we subcontract with from Cornell Cooperative Extension. So, for example, you know, white bread is a no-no.
Right.
I did white bread today because we weren't going through the New York State Office for the Aging, and generally, so I did half and half. I hope that was okay. Generally, it's either skim milk or 1% milk,
Right.
because we need to control for calories, fat, salt, probably carbohydrates, protein, and whereas I don't know if there are other programs that provide home delivered meals, what their nutritional requirements
So
are.
is your Meals on Wheels the same as your Catholic service?
That I don't know.
I can tell you, I get Meals on Wheels, and it's 2% milk that I get, but Meals on Wheels is furnished by Catholic Charities, and I've given a financial donation to
Oh,
Catholic
so it's
Charities
the
for
same
that.
thing.
Thank you. So, sorry about that. So, in Schenectady County, the program that we run is called Home Delivered Meals. It is interchangeable with Meals on Wheels,
Okay.
but at another level, there are other programs out there, Mom's Meals, I'm just thinking of any number of them, that provide meals. I don't know what criteria those other programs base their nutritional requirements. I only know what we can do, what we are required to do through Catholic Charities, whether you refer to it as Meals on Wheels
Okay.
or
Okay,
home delivered meals.
thank you.
You're welcome. Can be somewhat challenging to keep this all separate, right? Any other questions, comments, concerns? One of the things I would like to bring up, and I was on a 90-minute conference call earlier today before I came over here. One of the things that typically my organization, every county office for the aging actually in New York State is required to do, is to conduct something called a public hearing. And what the public hearing does is collect input, suggestions, suggestions for providing services to seniors, suggestions for improving services to seniors. Typically, we would be running those public hearings right now, and there's a whole process by which we run a public hearing. We have to post a legal notice in the Gazette for 3 days, 21 days prior to the public hearing. We have to send out budgets. We have to send out an announcement. There are a lot of requirements to doing a public hearing. The State Office for the Aging is not requiring us to do formal public hearings in the next few months, and we do it in preparation for sort of the next year's 21, 22, I didn't say 2022 already, right? You didn't hear me say that? For services during that time frame. But what we are trying to do is still reach out to folks because they know, there's a lot of space here, right? Some places in rural counties, even in urban places, they might not have this much space. So we are not being required to do formal public hearings as we have in the past. The New York State Office for the Aging is encouraging us to reach out to seniors anyway. So I would like to do that, and over the next few months, if I might invite myself back at some point to really have a discussion, and I can get information to you ahead of time. I'd love to be able to talk to you about services, your ideas, et cetera, if that would be possible. And my schedule is pretty flexible. Sometimes the deadlines and the timelines for these public hearings are...
Can you say what the topic was of the public hearings?
So basically what we have done is, in the past, we have sent out information. We've spoken about home delivered meals. We've spoken about congregate meals. We've spoken about all our services and the way in which we provide those services. Do we need to do a better job? There's always room for improvement, right? So what I have done in the past is sent out sort of a questionnaire for folks to look over, to give them an idea of what it is I'm looking for. So I'm more than happy to do that again. I can get it out to Edie, right? She can get it out to you, or I can mail it. We can figure out the best way to get you the information. Last year, at this time, we were preparing for our 4-year plan. Every 4 years, every county office for the aging is required to do a 4-year plan. So we were working on our 2020-2024 4-year plan. And the way we did that was through a needs assessment. We mailed out 1,500 needs assessments to folks, and we actually got several responses from folks in Niskayuna. We asked them on one page, what town in Schenectady County you live in, and we had a lot of people circling Niskayuna. And I still have copies of those, so if I can come back, I can show you what we did. And from that, that needs assessment was a fairly involved assessment on asking what your needs were regarding medical care, housing, can you shovel, can you drive, on senior centers. It was just very, very involved. So we're looking to collect information again from folks. So I'd like to be able to do that with all of you. Yes, sir.
Sorry.
No, that's okay. No.
Is your office for Schenectady County?
Yes, the
That's what you
services that we provide are for Schenectady County residents only.
Thank you.
I have a business card here. One of the programs we run is called New York Connects. It is a statewide program in every county office for the aging. On this business card, there is a local number, a 518 number, which is the number to my office, as well as an 800 number. So if you have friends or know people who live in other counties, you can give this 800 number to them, and basically the way that works is you call the 800 number, and the person answering the phone will say, what county are you seeking services in? You say Schenectady County, Albany County, Saratoga County, Oswego County, Erie County, and you will be connected directly to that county's New York Connects program. They don't give you a number where you have to hang up and dial again. As soon as you say the name of the county, it is a transfer immediately to that county's program. But yes, that's why it's called the Schenectady County Department of Senior and Long-Term Care Services. But we do have the ability to assist folks in getting services from other counties. Are there any other questions? Comments, concerns? Again, there's lots of information up here. Feel free to take what you think you need. And again, thank you everyone for your attention. Thank you to the Niskuna staff. I'm on your senior center mailing list too, and I have been very, very impressed with the services that the staff here have attempted to provide to you under very challenging circumstances, very challenging circumstances. Yes. Thank you again, everyone.
Thank you.